Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association explore medical topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today we explore attention deficit hyperactivity disorder, or ADHD, a condition affecting millions of children that challenges both them and their parents. Globally, about 1 in 14 children have attention deficit hyperactivity disorder, or ADHD. It affects boys over 2.5 times more than girls. The attention deficit part of the diagnosis means that those with it are more likely to be easily distracted, have trouble paying attention, or daydream. The hyperactivity part of the diagnosis means those with it are prone to hyperactive behavior and difficulty controlling impulses. They often will fidget with their fingers, with their rings, or with their hair. Kids do not necessarily grow out of ADHD, as about 60% of patients carry that diagnosis into adulthood. Importantly, ADHD means it's more likely that those with it will have other mental health problems, such as anxiety, depression, and autism spectrum disorder. Yet, nearly 40% of children with ADHD don't receive treatment with either behavioral training or medication. Joining us today is Dr. Kathleen Berchelmann, pediatrician and mother of 7 children from Connecticut, who both sees pediatric patients and runs mycatholicdoctor.com, a telemedicine platform providing virtual medical care for patients from around the United States, a platform that she co-founded with her husband. Kathleen, welcome to Vital Signs.
Thank you so much for having me.
Kathleen, I keep hearing the acronyms ADD and ADHD. Which is it, or are they both right?
Well, ADD is attention deficit disorder, and then some, but not all people with ADD have hyperactivity associated with their attention deficit. So that's called ADHD, or attention deficit hyperactivity disorder.
So when I read about the characteristics of ADHD, it sounds like somebody with a sanguine, outgoing, extroverted temperament who often misplaces belongings and loses track of time. So what makes ADHD different from that type of person?
People with ADD and ADHD are constantly seeking stimulation. There's something about their neurochemistry that is understimulating of the brain. So they seek to self-stimulate. And they do this in any number of ways, especially when they're young children. They may move constantly, almost like a machine. They may self-stimulate with food and overeat. They may self-stimulate with video games and computers, right? There's many ways to self-stimulate. And then as adults, many of them use and overuse caffeine, which is a stimulant.
So paradoxically, they're actually stimulating themselves so they feel calm, which that's amazing.
Right.
And when parents see this behavior in their children, they might be tempted to punish them. How can such an action of punishment backfire on raising such children?
Well, kids with ADD and ADHD are constantly, being told to calm down and to change, and they're constantly trying to have behavior modification from parents and teachers. And it's just not effective, right? You need to treat the ADD, not punish the ADD. And you can do that with behavioral mechanisms and with medications.
So when parents see a very active child, how can they determine whether or not that's just their personality or they actually have ADD or ADHD?
It's very hard in young children, especially under age 5. There are some people now that do make the diagnosis at age 4, but most people still wait until age 5, some people at age 6. But by that point, you can tell if the child is able to calm themselves at times by choice, or if they are a constant, you remind them and then they go right back to it. And if they're really self-stimulating, especially self-stimulating late in the evening and times when they should be tired, or first thing in the morning, and sometimes they're self-stimulating by being angry, Some kids with ADD and ADHD are very angry in the morning because angry is very stimulating. Actually, it causes this release of lots of hormones in your stress hormones in your brain. Effective management of ADD and ADHD is anger, right? Or at least it treats the brain right, but it's very unpleasant for people around you. And so if you see this child that just can't be, effectively redirected with cognitive behavioral therapy, with normal parenting, with logic, that's when they really should have a formal assessment by a physician.
Well, so you mentioned that anger can be a part of self-treatment unwittingly by these patients. How is that different from another disorder you've told me about called oppositional defiant disorder?
So, oppositional defiant disorder is a child that is stimulated by in any way. Sometimes they find it enjoyable to be oppositional. And in many kids with ADD and ADHD develop oppositional defiant. So what I find, and this is just my observation, is that children with ADD and ADHD kind of go in two directions, especially if they're not treated. One is depression and anxiety, and the other is oppositional defiant. And it makes sense because you have this child who's constantly being reminded, sometimes hundreds of times a day, by parents and teachers and everybody to change their behavior. And they very quickly kind of decide, even with my best effort, I'm not able to change my behavior to keep my parents and my teachers happy. So there's something wrong with me. And there's a sense of despair, and they tend to go towards depression and anxiety. And there's this constant anxiety of, am I doing this right? Am I doing this right? Am I doing this right? And they need lots of reassurance that they're doing the best they can. They're doing a good job, right? And they get really depressed. I'm terrible. Everything I do is wrong. But then there's these other kids that are reminded so many times to do what's right. And finally they're like, look, I don't care about you. I'm going to do it my way. It's my way or the highway. And actually, when I get to say, actually, no, I'm not doing my chores, that's actually kind of stimulating to me. And I actually like it. So that's called oppositional defiant, right? And in some ways, kids with oppositional defiant can actually do better in life with untreated ADHD than kids with depression and anxiety with untreated ADHD. But why do any of this? Let's just treat the ADD and the ADHD.
Well, so coming up to treatment, I mean, parents have fears about ADHD itself. They have fears about the treatment. What are some of the main fears you have heard from parents of children with this condition?
Well, I hear a lot about the stimulant medication and fear that that medication will become addictive or that it will be abused. And there are many ways to treat ADD and ADHD. The first is behavioral. I always recommend behavioral interventions, whether or not you're on medications. And in fact, medications, without behavioral interventions, just aren't as effective, right? You've got to do these interventions, which is, and we'll talk more about them, but it's a whole lot of routine, and clearly stated expectations, et cetera, right? But behavioral interventions, when combined with medication that is appropriately prescribed, is very effective treatment. There are some medications that are stimulants, and there are some medications that are not stimulants. But actually, I really like old-fashioned Ritalin, which they've now put in a slow-release capsule, which is called Concerta, or methylphenidate extended release (ER), is the generic name of it. And this drug is really old. It's been around for a lot of years. It's been very heavily tested in studies that were not influenced by the financial concerns of pharmaceutical companies. We really know this drug. And this is what we know, that it works, that it's effective, and that when prescribed appropriately, kids don't become addicted to it. Now, it can be sold on the black market, and there are ways to abuse it. But that's why we have these very strong controlled substance, prescribing laws for physicians. I just don't see a lot of that anymore. I'll be honest. 20 years ago, I did see it. I did see kids coming into the ER that were high on illegally obtained ADHD drugs. I don't see it anymore because it's so hard to get because it has to be prescribed in certain quantities, et cetera.
So, Kathleen, if parents who are listening have children with ADHD, what can they expect about the natural course of it from childhood through the teen years and into adulthood? Does it mellow out, or is it always there?
It's always there. You're born with this brain. Now you can learn discipline, and you can grow in virtue, and you can grow in maturity, and you can grow in knowledge, right? And all of those things can help you as an adult, as a young adult, modulate that behavior so that that person with ADHD can learn to modulate their behavior even without medication. And they may be able to get to a point as a young adult where they don't need medication anymore. And I think that is always a goal. But many people do stay on these drugs throughout adulthood. A lot of adults also transition onto coffee, which if you just sip a cup of coffee all day, it's like taking an extended release dose of Ritalin, right? The problem is kindergartners can't, sip coffee all day, right? So transitioning to things like exercise and coffee as an adult as forms of stimulation is very reasonable, and many people do it. But that basic brain chemistry and structure really doesn't change. And so adults with ADD and ADHD are going to find other ways to self-stimulate. And I think it's important as an adult that you're to realize, to just verbalize this, especially, young adults, that they may be switching to video games. Maybe when they're in college, they're having a really hard time keeping up their studies because they're using video games to self-stimulate. But the public will tell you, oh, you're grown out of your ADD, you've grown out of your ADHD, because they're not causing the disruptive behavior in the classroom, because they're not moving all the time. But that brain chemistry is still there, and they're still going to try to find ways to self-stimulate.
So, Kathleen, during the pandemic, there has been a relatively famous online couple making videos, and the husband often wears a T-shirt that says ADHD is awesome. In other words, he says to the world he has it. So we've been looking at ADHD just as, some negative aspects of it, but are there any positive aspects of having that condition?
Sure. Some of the world's most successful people have ADD and ADHD, some of them even choosing to go untreated. The founder of JetBlue Airlines is one of them, and he's founded a whole bunch of these, Neiman is his name. He's founded a whole bunch of these airlines, and he is also a self-proclaimed untreated ADHD because he feels his desire for stimulation is played out in his creativity, and that's what drives him to be the excellent serial entrepreneur and CEO that he became.
I think it's wonderful to point out that, everything we're given in this life can often have a positive side. Now, but back to a challenging side. One of the ways that you say parents can best help these children is by prescribing no fun parenting. What does that mean?
Right. So no fun parenting is doing what you need to do as a parent, right? And this goes back to this concept of discipline. The discipline doesn't just mean, punishment, and it doesn't mean corporal punishment. Discipline means doing what you don't want to do and choosing to do it with a good attitude. And that's really important, right? That we teach our children that there's three parts of obedience, and obedience is a form of discipline, as joyful, immediate, and thorough, right? So doing what you don't want to do joyfully, immediately, and thoroughly, that's discipline, right? And so teaching kids from the very beginning to do that, to obey their parents, and to have a routine, to enforce those chores every day, even to enforce things like wake up time and bedtime. All of this takes discipline as a parent, and that is no fun parenting. But that's when it's going to help you to really raise a successful child. And it's true for all children, but it's even harder if you have a child with ADD or ADHD. There's even more no fun parenting, because a child without ADD and ADHD is going to learn how to follow the family rules and do their chores over a short amount of time. But a child with ADD and ADHD is going to take reminders for 16, 18, 20 years, maybe their whole time they're in your house.
So this reminds me of something you've said to me before, is that children with ADHD don't need a policeman, someone to correct them, but they need a secretary. Is there any more you'd like to say about that?
Yes, thank you so much for reminding me of that analogy that I frequently use, that kids with ADHD need reminders. They don't need punishment, right? They need a secretary, not a policeman. Now, kids with oppositional defiant need a policeman, and we'll get to that. But it really helps to make someone or something else be your child's secretary, because after a while it really interferes with your relationship with that child. So I love using automated assistants. So for example, these Amazon Alexa devices, and there's Google Home, or even a smartphone that has regularly set alarms or reminders that say it's time for chores, it's bedtime, it's wake up time, all of these things, so that I'm not the one telling the kids that it's actually, you do have to do your chores now. It is time for our family rosary, right? And it gives them a break too. If the Alexa is saying it's prayer time, then they're not tempted to say, "Mom, I don't want to say the rosary tonight," right? That's what I often hear, right? When I was calling them for rosary, but when the Alexa calls them for the rosary, there's they don't fall into that, right? They don't fall for that temptation.
When practicing no fun parenting, it's easy for a parent to get angry with their children. How do you recommend parents deal with that anger?
The first thing is, as long as your child is safe in the immediate moment, just take a deep breath and get away, and sometimes call somebody else to help, like your spouse or another person that helps you raise your children. Um, just trying really hard not to act out of impulsivity, right? Our best parenting is usually not occurring in impulsivity. Take a breath, get away, and let and really reflect on the behavior before you start planning your disciplinary approach.
I agree with that. My hall of shame as a parent would be full of all the things I did impulsively. That's great advice, Kathleen. And the opposite of impulsivity is routine. What is the value of routine in raising these children?
It's number one on the list, and I think you need house rules, hopefully modeled after the Ten Commandments. You need family schedule, preferably a family prayer schedule. All children, but especially children with ADD and ADHD, really need to be mentored in their ability to learn how to pray, and that's a whole nother conversation. That people with ADD and ADHD pray like they behave, right? Their thoughts are like all over the place. They can't just like sit in adoration for an hour, or, even mass can be really, really hard. But, God made them that way. And God listens to them, and He knows that their prayer structure is going to be different from other people's prayer structure. And so just constantly, I think teaching these children to talk to God in little pieces all day, rather than trying to have a big block of time, but still having that scheduled group family prayer time, such as in the morning at the breakfast table, in the evening at the dinner table, and then hopefully family rosary in the evening, and really trying to combine structured prayer and individual prayer. But they need to be mentored through individual prayer, and that I think the way we teach children to pray, um, memorizing long prayers and long periods of sitting still, and concepts like adoration. And all the people that tell our young adults again and again they need to take time for prayer, and they need to quiet themselves and be still. That is 100 times harder for a young person with ADD and ADHD. And it's still a good thing to do, but God still hears their prayers, as disjointed as they will be.
I love hearing that advice because we sure don't get it in our textbooks or in medical school. Kathleen, what trustworthy resources can you recommend for parents raising children with ADD or ADHD?
The first resource is that God made you is God, right? He made you to be this child's parent, not anyone else. And you may feel like you're an incompetent parent, but actually you're the right person to parent this child. So number one is you. Resource number two is is the Ten Commandments. Write your house rules and model them after the Ten Commandments. We have the Berchelmann Ten Commandments, and for many years we recited them every morning at the breakfast table. Now that our kids, can say them in their sleep. They don't always follow them, but it's very useful
But they know
because
them.
they know them. And so when they break them, it's really easy for us to say, you're supposed to respect other people's things, right? And they respect other people's things is one of the Berchelmann 10 Commandments. So it's very easy for us to name the behavior and the kid to recognize the wrong behavior because the rules have been so reinforced. So I think house rules is a really important thing for every family, but especially families with kids with ADD and ADHD. And then 3 is that routine and sticking to it and asking God for the grace for you as a parent to stick to the routine and to give you the virtue to stick to the routine, because that is really, really hard.
Kathleen, thank you. You've taken time out as a parent who's seen these behaviors, who knows what works, and you've given our viewers something practical that they can use. Thank you so much for being with us on Vital Signs.
Oh, God bless you, Dr. McGovern. It's always a pleasure, and thank you for your beautiful work.
I think today the best lesson I got is that routine is the key to raising children who need so much stimulation and to allow them to pray and be in the way that God made them to be. Thank you for watching another episode of Vital Signs, your prescription for a healthy family. Brought to you by Shalom World TV and the Catholic Medical Association, where we are inspiring physicians to imitate Jesus Christ. Please join us for our next episode and share the good news of Vital Signs with a friend, and may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
Are you searching for purpose of life? Discover your true identity. Stay tuned to Shalom World.